Today, we're presenting healthcare interoperability, breaking through data walls to optimize patient care. We're here with Jennifer Stango, VP of Client Success and Industry at Arbella Technologies, Dina McCory, Principal for Healthcare and Life Sciences, and John Rastia, Director of Innovation. So without further ado, let's get started. Jennifer, over to you.
Thanks, Halloran. Thanks, everybody, for joining us today. As Halloran said, I'm Jennifer Stango. I'm the Vice President of Client Success and Industry Solutions. I've been doing Microsoft Dynamics for a little over 20 years, focused on the healthcare and life sciences space for the last 10. Dina?
Hi, Dina McCory. Nice to meet everyone. I'm Principal in Healthcare and Life Sciences with 15 years experience implementing Microsoft products. And for the past 5 years, I've been implementing healthcare solution using the Microsoft platform. John?
Hello, this is John Rastia. I'm the Director of Innovation. I have 20 plus years in the Microsoft stack across multiple industries and across multiple platforms.
Great, thanks. So we want to go a little bit over Arbella today. Thanks, Dina. I guess agenda. So we did introductions, Arbella overview, and we'll do a little bit of interoperability and what's happening in the market today. Talk about how Microsoft's addressing it, and then we have a demonstration of how to manage care with device monitoring, and then we left some time for Q&A. So a little bit about Arbella. Arbella is a Microsoft Gold partner. We're also part of the Inner Circle, which is a very select few of partners in the United States. We support the whole industry stack, meaning that we abide by Microsoft's tech intensity, which is ERP, CRM. We also do Azure services like IoT, machine learning, AI, digital twins. We support multiple industries. Today, we're really focusing on the healthcare life sciences provider payer market. In addition, we do manufacturing, distribution, engineering services, connected field services, retail. As you can see, we have about 250 employees available, and we cover the globe. So if you go to the next slide, not only can we service you as our customer in the United States or domestically, we also have the ability to do it throughout Europe, and we have partner experience in some of the other countries. And if we go to the next slide, Dina, a little bit about why Arbella. Arbella is a trusted partner, as you can see from being a gold partner and that 2%. And we also go and really we're client focused. So we're looking at what your results are. So we're not meeting with you just about what you're doing today. We're looking about that long-term approach. Where is your business going in 2 years, 5 years? Because we want to make sure that we're partnered with you and that we're actually driving towards your ultimate success or where you're going to be. We really look at it from industry IP. We're industry experts in healthcare and life sciences. We follow PHI and HIPAA guidelines. We try to get it right the first time. So that's by meeting with you, and we really use an agile, quick to value methodology. So we're going to get your requirements. We're going to build out some models, come back and make sure that works for you, and then go back and address any of the issues we have. So we're very much into innovation. So you'll see that throughout our presentation. We've really kind of gone into the better together with Microsoft message and what technology is going to look like for you. So a little bit about healthcare interoperability. What this really started with back in 2009 was the concept of meaningful use. Meaningful use evolved into what we call interoperability today. And interoperability was key to kind of ensuring that a patient or a consumer of healthcare was going to get the right care by the right person at the right time. This was really kind of crucial to changing the healthcare industry model and creating a foundation where data was going to be easily available and accessible to the healthcare consumer, patient, provider, and the health plan. What we really found out during COVID is that systems were not interoperable. And we really kind of started doing some exploration about how the pandemic impacted data interoperability. And if you want to go to the next slide, Nina. What was really happening is COVID brought to light a whole bunch of issues surrounding the lack of patient-centered care. The big thing that came out was data was siloed. It was not real time, it was paper-based. They also found out that data was cobbled. There was multiple duplicate testing. There was stories going on that someone wound up in an emergency room, they got a COVID test, and then they went into a hospital, they got a second COVID test. That was really hitting for higher expenses. there was a ton of data missing from health records. According to the Duke study, about 50% of the lab reports lacked address or zip code data. That was key data that they needed to identify upcoming clusters and hotspots. And with that, they couldn't plan effectively for COVID. So in Southern California, maybe we were a hotspot, and maybe it was down to a region. They couldn't identify that because the zip code was there. So we saw clusters, or we saw the wrong equipment, the wrong ventilators at the wrong place at the wrong time. They also really looked, and when we started looking at pandemic, it was the imbalance of care in rural and low-income areas. Medicare beneficiaries historically have a 40% chance of being hospitalized compared to someone that's not on Medicare. And that's because they don't have access to specialized care. When you start thinking about the imbalance of care, data interoperability combined with predictive analytics could really improve healthcare incomes for vulnerable populations. So when Arbella started really looking at this and designing what we call Arbella Health, we were looking to design the concept of a single source of truth for healthcare. It was going to be a consumer patient-centric dashboard. And it's going to be that complete view with a comprehensive medical record versus making providers into medical detectives, trying to figure out and piece together that siloed, frozen data. The goal was to end days of disjointed care and reduce patient safety. When we started looking at telehealth, and we were really researching it with Forrester, more than 1/3 of virtual care visits are for mental health right now. Mental health has become the shadow crisis of the pandemic, and it's really going to be driving that concept of virtual care or telehealth moving forward. They're saying that mental health is going to stretch into 2021 and 2022, given people are at a breaking point with COVID. Virtual health is kind of something that's scary to people. And the reason why is there's that siloed data going back to it. If I suffer from headaches and maybe I fall and all of a sudden I think I have a concussion, if I call and I say I have a really bad headache and maybe I have a history of migraine, that virtual health provider didn't have access historically to that data and may give me an incorrect care plan. If we had that single source of truth and they could look and see my whole health history record, my experience would be much better. In addition, if we can make this real time, a primary care physician who I've been dealing with and I trust can follow up with me about that care plan and reassure me it's the right care plan for me. We're also seeing with telehealth is the concept of chatbots and knowledge bases. Historically, people have gone out and looked at Google and been checking, do I have COVID, and looking at incorrect information. If there is a chatbot and a knowledge base where you can put your symptoms in, it could also be something that backs up and looks at your historical information about your record, your health record. It would help drive that conversation with you and make a determination if you need it virtual health or if you need it to actually see your primary care versus Googling my symptoms, making a decision, calling my doctor in a panic. The other thing that really came out of global interoperability was vaccine management. It's the first time ever we were seeing verification of shipments going and that they were kept in refrigerated temperatures for 5 days, and 5 days was when it would expire. That, in addition, we could track healthcare workers and people if they were getting their first and second doses. And when you think about it, if you got Pfizer the first time, they had to make sure that I was getting Pfizer the second time. So they were sending it to whichever provider I went to for my first and second shot. So vaccine management really exploded, and global interoperability started driving this. With lab results, digital transformation has hit that really hard. What we're seeing is testing data. So if you walk into Costco right now, or even on Amazon, you can get a testing kit for COVID. Where is all of that data going? Well, now with interoperability, you have the ability to take that test at home, get the lab results instantaneously, and share that with your primary care, your public health officials, so we can see if there's another outbreak coming. And so that, I think, is going to be the best thing for transformation right now, was getting the right information with zip codes and address. Geographic data is going to be in there. And, what we saw really with COVID, and think about the vaccines, it normally takes a minimum of 10 years and billions of dollars to bring a drug to market. I mean, this is one of the fastest drugs we've ever seen to come to market. And a lot of that was driven by proactive tools available to us, machine learning, AI. We can apply that towards predictive care as well. And I was on an interesting healthcare webinar last week, and they were talking, it normally takes 100 years for there to be radical healthcare change. With COVID, it's been driven down to 72 months. And they think within the next 6 months, given this whole proactive predictive care models, is that we will be down to almost 3 months before we will see healthcare change. So interoperability is really changing, and COVID-19, right, wrong, or indifferent, drove a lot of this change to where we've increased our digital transformation and lab results. We're now tracking vaccines to a better degree. We're getting to the point where we are unfreezing our data and having a single source of truth for healthcare consumers. So I'm going to turn it over to John and Dina, and they're going to go over the Microsoft platform for you.
So this is Dina, and let's talk about the healthcare in transition and how the healthcare industry is burdened by aging populations, provider burnout, and patient dissatisfaction. Now add in the COVID pandemic, which forces the healthcare industry to rethink those established norms and current operational best practices. The question becomes how to bridge the gap, looking to the present and the future for scalable healthcare solutions using the latest technology advancements. A few areas how healthcare is transitioning now is first, virtual health. Telehealth usage has increased 40% because now consumers are looking to more flexible healthcare options. Second is the interoperability, as Jennifer noted earlier and spoke to, taking the 90% of unstructured data into usable data that allows for healthcare professionals to make effective and efficient healthcare decisions. And third is the healthcare outcomes make it easier for providers to focus on key data elements instead of multiple systems, multiple notes. And fourth is the security. Obviously, we need to be secure, compliant. Privacy for your healthcare records and patient data is fundamental to solving healthcare technology needs. Now, John is going to discuss how Microsoft's ecosystem and how that helps with this healthcare in transition. John?
Thanks, Dina. At Arbella, our healthcare industry solutions equip businesses with new applications and tools to engage in the digital world in new ways and provide differentiated solutions to compete more effectively. Arbella leverages that emerging technology to make work more meaningful, rewarding, efficient, and safe. Our solutions and services from smart connected operations, through which we're going to be demoing later, through some IoT, some augmented and virtual reality applications, and our frontline worker capabilities are redefining the future of work and how we work. So when I'm looking at this diagram right here, this is kind of like our architectural Lego diagram. I'm calling it Lego diagram because everything here is connected. And when we start down on the bottom, we have our entire Active Directory common data services, so we can quickly connect into your existing Active Directory. So what does that mean? So just in layman's terms, our applications are going to be single sign-on. Okay, we're not going to have a different user and a different password. It's not going to have to go through different systems. With Common Data Service as an example, we can now connect your existing data platforms into commonly used applications. Okay, so and I'm all the way over to left-hand side, the left-hand block there under productivity. Tools like you use today, you're using Teams, you may be using Outlook, you might be using Excel spreadsheets, things like that. Those are connected Legos in here. So if you've got data systems that you want to work and collaborate, we can easily do that. But not only are we collaborating on tools like we are during this webinar, we may want to take that data over into other intelligent business applications. Your frontline working capabilities that we have here can be automatically added. And plus, because they're connected, we're not having to, extend integrations. That integration is native, it's out of the box. Now, of course, I'm in the middle block there. Of course, we have all of the machine learning, things like cognitive surface, things like we're going to be demoing today, the Internet of Things, the Internet of Medical Things, okay? All that is data that we're going to be showing in multiple areas to show how different workers and different people have access to that. Okay, and really what that kind of means, and you know, in all of this, because it's Microsoft ecosystem, they're connected blocks. We're not rerunning applications, rerunning different, you know, integrations to do this work. We're putting that AI, that buzzword AI, we're putting AI to work for you. Okay. So just taking a look at, you know, the Microsoft, you know, cloud for healthcare, you know, and some of its capabilities. Again, we can take this data, and from a beginning point, we can like enhance your personalized care, because we're going to have the data for it, you know, for the persons that we're caring for, and the care plans. Those might be in different systems, but we can pull that data together as an example. Okay, and then, you know, with the integration we talked about, I can quickly send emails and notifications with all those, you know, touch points. I'm looking at the virtual health areas here, because we can and we will be connecting to many different, you know, device data, whether that be, facility data, you know, devices, or, you know, what's now these medical, you know, wearables. So, I mean, that's what we're going to be seeing a little bit today in today's demo, but a lot of that's, you know, around the virtual health and how do we connect that and getting that information to us. Of course, we have the, you know, down towards the bottom, the operational analytics. We're going to be able to gain all the actionable insights. Okay, what does that really kind of mean, right? So when we take all these different data points, and Jennifer and Dina were talking about before, that if somebody, has a care plan, they do have, like, you know, sometimes some seizures, or, you know, based upon some headaches, we can help the system learn from that, learn from the people that have these care plans, and build some predictability cases on them, so we can be as proactive as we can get into it. Then, of course, on the right-hand side here, it's got the entire care team is going to be collaborating using the tools that they have today, your Outlook, your Teams, Excel files, things like that I can continue to use. And now we're starting to all collaborate without like having some very, some costly integration pieces. And that really, you know, allows us to do continuous patient and person monitoring across multiple devices. So that really kind of brings us all the way back into how we're going to personalize the care for each individual.
So now let's talk about how we want to empower healthcare organizations and make it easy, as you can see, to bring all healthcare components and cloud apps together. So it kind of talking to what John said, we have the healthcare cloud components as APIs, configuration, you have apps, you have connectors, you have templates. And then with Microsoft Cloud Services, with Microsoft 365, Dynamics 365, and the Power App, Power Platform, and Microsoft Azure. So how does Microsoft differentiate itself? It's the security commitment with a trusted global platform that has compliance in place. There's an end-to-end workflow ready to go, as John mentioned, with Azure AI. There's human workflows with Teams, and business-driven process with Dynamics 365 and the Power Platform. It's connected apps. It's all seamless data. It's all going into Azure and Azure Data Lakes. It has the ability to turn on, turn off apps as needed. So if you don't want this app today, you can turn it off. And then the partner network. Microsoft partners, such as Arvella, extend healthcare solutions to meet the tech intensity needs of the healthcare community. So let's talk a little bit about how the Microsoft Cloud for Healthcare just enhances the patient engagement. So first, obviously, you want to personalize the experience, drive the positive health outcomes with a 360-degree view of the patient, and expand care access with virtual visits, as Jennifer has talked about, as well as John. The second way that this Microsoft Cloud for Healthcare empowers the health team collaboration. So you're now working as a team. So your care team collaboration across different organizations, your care coordination helps with care management as the care plans, and what's the next best activity based on all the data, based on your care plan. What is the next best activity for you as a patient, as well as scheduling and resource optimization, and the continuous patient monitoring with the device IoT. The third way is just improve the data insights. The Microsoft Cloud for Healthcare improves the data insights through data interoperability by connecting data across multiple systems. By connecting this data, now providers and clinicians have the data in front of them to drive the analytics right at their fingertips to make those efficient and effective business and patient decisions. So finally, of course, we can't forget about security. Obviously, it's protected through security, compliance, and privacy. So now we're going to get to the fun stuff. We made you wait long enough. So we're actually going to do a little show and tell, but tell and then show. So we're going to show managing care with device monitoring. So Jennifer, I'm going to turn it over to you to talk a little bit, tell a little bit about the healthcare advantage.
Sure. So Arbella Health Advantage, our goal really was, like we've said a few times, was to improve the patient experience with healthcare professionals. If you're familiar with healthcare, there's really the quadruple aim, and we created the quintuple aim, which was elevating patient engagement, improving the experience of care. And how we're doing that is we're trying to consolidate multiple data points into the Microsoft solutions that are going to help improve the patient outcomes and the experience of care. This is going to allow healthcare professionals to quickly assess data and determine the next best action. So I'm going to turn it over to John and Dina to tell you a patient story and how this is going to drive through the healthcare professionals.
Yeah, we're still telling. I promise we'll get to the show and tell here in a minute. So it's really just looking at continuous patient monitoring and how we add value by combining the Azure IoT and analytics to drive those data decisions. We're doing this through the IoT devices, custom dashboard, virtual consults. We're going to show you Power BI. We're going to show you device IoT. And then, once we've connected all that data, it's important for you to quickly be able to access that data and make the best decision. So you can be a person, a patient with your wearable device, and then that device is going to drive the data to the next steps. So John and I can, John, you talk for a second while I'm going to switch screens while you guys are waiting on me. Okay.
Yeah, so this is a visual representation, and you'll actually see this dashboard in the solution when it comes up, and they have some wearable devices, and you can apply this towards any device that a healthcare consumer was wearing or using. Go ahead, Dina.
So yeah, thank you, Jennifer. So we're going to do 4 different use cases today, and we're going to start with Dynamics 365. We're going to basically show the Heather Collins is a healthcare professional. She comes in, her daily dashboard is going to give an alert, and then we're going to show how Gabriel's monitoring her device, her pulse ox, and then John's going to show the device IoT, and then we're going to show one last scenario around a nurse manager monitoring patients in a rehab facility. So let's go with the first one. So I'm logged in as Heather Collins, and Heather automatically logs in for today, and she can see that she has 3 high patients based on their alerts. And so what's going to happen is, let me go back to my dashboard, of course. This only happens when you're doing a webinar. So if you look, Brian actually is having trouble breathing. And so he automatically, an appointment was created for him to actually go see his primary physician today. So if I look in my activities for my patients, an appointment was scheduled for him to go to a primary care physician. Then if I look at my other high priority patient, Diana, she's unable to walk due to swollen legs. And based on that device alert, I was able to see that the system automatically scheduled an appointment for her cardiologist on Thursday of this week. And then my last high priority patient is Claire. She's feeling extremely tired. She's not feeling well. So I need to see how she's doing. And so I want to follow up with Claire. So I want to look at a little bit more information on Claire. So if I click through to Claire's patient record, I can very quickly see her demographic information, all the interactions that have happened with Claire, as well as her care team, the current care team that's working with her, and any care plans. This care plan was automatically added based on her device alert. So now I know that she needs to be on a certain plan with certain activities based on her not feeling well, her low oxygen reading from her device. So that's, if I'm a healthcare worker, I can quickly come in and see, oh, yep, I've got all my patients that are high priority. I see what has been going on in terms of scheduling and appointments. And then I can look over and see their high temperature, their high blood pressure, their pulse ox is low. So now let's look at it from a different view. And let's say I'm looking at all the devices themselves. I'm not necessarily looking at the patients. I just want a different view of the data. So now I want to look at the actual device data. And I can see that Claire has, you know, she's good. She has a little low pulse ox. Maybe that's why she's not feeling great. But I can actually go here and see that Claire is not having a good day. It's why she's not breathing well. And then I can also look at, we also have blood pressure, cuffs in here, as well as glucose monitoring. So you can take a look at what's going on with your patient and the device readings that's coming in. And then once that device reading comes in, then you as a healthcare professional can then go in and look and see what next step do you need to take. Did the system automatically schedule a phone call for you to call your patient, or did they automatically schedule an appointment to see their primary care physician? And then obviously who's their care team in the care plan that was added. So now I'm going to let John start talking through his scenario, and while I get his dashboard up. So John, go ahead.
Yeah, thanks. So in this next use case, we're going to be taking a look at the Internet of Medical Devices space and why that's important. And that's really important because the continuous patient monitoring is one of the key enablers of reducing the risk of readmissions, managing the chronic diseases more effectively, and improving the care plan outcomes. So continuous patient monitoring can be split up into, into two major categories, and that's inpatient monitoring using medical wearables and other devices in the hospital. Care teams can monitor patient vital signs and medical conditions without having to send a nurse to check up on a patient multiple times a day. Those care teams we talked about can also understand the moment that a patient needs critical attention through notifications and prioritizes their time effectively. Another major category that we're looking at is the remote wearables. Okay, so by using those medical wearables and patient-reported outcomes to monitor the people outside the hospital, the risk of the readmission can be lowered. Data from chronic disease patients and rehabilitation patients can be collected to ensure that the people are adhering to the care plans. And that alerts of the person, if they're looking at high temperatures, if they recorded a fall, can be surfaced to those care teams before they become critical. Here, on the screen, we have like just one of those, one as an example. We've got two wearables right here. We've got the Smart Vitals patch and the Smart Knee Brace, and that we're constantly monitoring. So right from here, this dashboard, anybody that's given access to this, of course, this is all on the Microsoft application, so we are fully secure. So if you've got access to this, I can see patch information, the wearables, such as temperature, battery levels. I can detect a fall. Then what I can actually start to do here is, now please click on go to the device page. This dashboard will take us directly to the devices so I can see who's all wearing these devices. Yep, thank you. So this quickly now just takes us over to the area where we can see all the different devices, all the wearables, whether they be remote or inside the hospital. Very easy to set up. This is not something that you're going to have your IT come down every single time that you put a wearable on something. This is just when you check in a patient and they've got a wearable and they're checked in, automatically has all their information highlighted. So let's just go ahead and highlight. Let's go down to Gabriel's. Yep, knee brace. So by clicking on this, the other dashboard was showing all the information being collected. Now I'm actually just kind of like looking at Gabriel's. So I can see the person, location, size, type, any information that's actually coming from the device. I can see its current temperature. If I need to update the device, anything down there. And if you could scroll down just a little bit here, we're just kind of looking at the device temperature, batteries, and we're actually looking at the bend radius. Are they using it? Are they bending their knee? So again, these are just examples of what we're capturing from this, but not only are we looking at this, we can turn this into actionable insights and data. We can build into rules and where we can actually start to set up to say, if we're looking at the temperature, battery, or rotation of this knee brace, and if it meets a threshold, send us an alert letting us know that Gabriel's having some issue with her device. So what we're going to kind of do right now is we've kind of simulated that a little bit on one of the temperature. So it kind of went over temperature on this particular device, and it's going to send an alert back over into the nurse's station there so we can look at it. So let's go take a look at that. So a little bit like, where Dina was and looking at care plans, all this information's in one place, right? So right here is our alert. I get some information on it. So go ahead and click that and let's see what's going on. So right away, I'm presented with quite a bit of data here, but this data is going to help us very quickly. I'm not going to go through every different piece here, but I understand what device it is, what the alert type is, what care plan has it already been assigned to. So I can kind of see, like right here, that Gabriel is part out of one of our care plans. We don't have to do it in this demo, but if I wanted to, I could drill down and click on that to get me more information. But I have the device information, all the alert data, and I really want to put your focus right now onto the right-hand side under suggestions. So right now, this application has the machine learning capabilities that is putting AI to work for you right away. So as soon as something comes in, it's going through and identifying what the priority is. It's assigning it a score based upon data that's been presented to us in the past with this particular person and their care plan. And right away, it's telling us what they have to do as probably the next best steps and actions to fix this issue. Of course, I've got, all the other, right below that, I've got additional alert information. I can see that I've already gotten 2 alerts. Have we created cases? Have we scheduled work orders, any kind of visits from the doctors, or whether that be remote or in the hospital? All that's being tracked right here. And the final thing that I want to quickly show here is up on the top. It's up in red, and we kind of call that's our process flow. And what this is going to help, anybody that's looking at this process flow will help them walk through every single step and stage to fix this issue that gets Gabriel up and going very quickly, while having the care plan information, the device information, what happened, and next best, and what they suggest on how to fix it. Okay.
Okay, thanks for that, John. So now I just want to do one last scenario. If you're basically a manager on a hospital floor and you're monitoring your patients in a certain room, and based on their blood pressure cuff or their glucose monitor, Gabriel has a red based on the high blood pressure of 155/95. So if we just want to very quickly just go in and drill into that patient status, then we can quickly look at Gabriel back in room 103B, and then we can look at his vitals. Of course, this always happens when you're doing a webinar. And then you can basically look at all of the vitals and the trend in the data over the past hours, over the past days, and also the range of motion on that knee brace that John was just discussing. So we've discussed 4 different use cases, 4 different scenarios where we've had a healthcare coordinator look at our high priority patients and basically say, I need to very quickly see how they're doing from a dashboard standpoint and adding a care plan. And then basically looking at the device itself at the patient level. And then John basically going through a smart knee brace and the analytics behind monitoring a smart knee brace, as well as a Power BI dashboard monitoring patients in a hospital room. So I'm going to turn it over to Jennifer for any last comments or words.
Yeah, thanks, Dina. Thanks, John. I know we showed what I'm going to say a lot of proactive, but one thing we've been talking about internally is the concept of predictive analysis. And so someone that's wearing a wearable tech, and it could be a watch, and that watch sees how much I stand up and how much I walk around. And when you think about doing predictive analytics for fall risk, and you can apply this to people in nursing homes or home health scenarios, someone that sits for longer periods of time, is not as mobile, has a higher chance or like a higher indicative of falling. So what we can do is also do proactive. And so if I've been sitting for long periods of time and I have a higher fall risk, is send them text messages or call them on the phone and say, Jennifer, you need to get up and move around a lot. So this can be used in both directions. We can look at data and do that remote monitoring of the device and make sure the device is active. We can do that remote monitoring of the patient and proactively call them and say you need to take these steps to increase your quality of life, reduce your fall risk, and you can start applying that towards multiple healthcare scenarios. The fallen and I can't get up scenario is, can we stop those falls from happening? And the answer is yes. And going back to look at how quickly the COVID drug came out with all the technology tools that came from the pandemic, from COVID, we can apply that to increase patient satisfaction, patient health, reduce fall risk, reduce healthcare insurance claims. The applications to what has changed over the last 16 months is amazing. Technology is finally caught up to the point where we can unfreeze siloed data. We can look at the overall patient. We can do things like these scenarios that Dina and John showed us to really interact with our patients, with our healthcare consumers, and really meet that goal of data interoperability. So with that, that was our presentation today. I don't know if there's any questions, Halloran, that came in from the audience.
Yeah, thank you. At this time, I would like to invite our attendees to ask questions. You can submit them in the questions window in your GoToMeeting control panel. And let me start off here. How can I leverage this in a different industry?
No, I'll take that one. It's a great question. We're seeing this application quite a bit in life sciences. And so if you're a medical device manufacturer, as an example, you can use remote assist. And so think about it, we have the Internet of all things, right? Like we can see that medical device. Instead of sending a technician out, I can send a HoloLens. I can put a device sensor in it and see if it's over temperature or how much it's been used, and I can do predictive, proactive field service against it. That's kind of like one scenario we see, and we actually have customers that are doing that today. They have a device sensor. The device sensor goes through IoT. It hits back up against the quote-unquote asset. We can rev software against it. We can track the revisions and see what we've done to that bill of material to fix it. We also see the pharmaceutical applications of this. I mean, we all saw it with COVID, right? If you went out and you got the vaccine, I'm assuming you signed up for it, you're getting the text messages, and the text messages were saying, hey, Jennifer, did you have a headache? Did you have muscle aches? Did you have to see a provider? And it was gathering all of that data. And normally pharmaceutical companies don't get access to adverse events unless it's severe. But now they're actually getting information about how to re-engineer a drug substance or an API and reformulate that to where it's not causing the same issues. So this whole breaking through data walls to optimize patient care, I mean, it really applies across the spectrum, and going to that patient and saying, hey, and you don't even have to talk about it from the COVID vaccine, you could apply it to an everyday maintenance drug like a statin. And if statins are causing stomach aches, why not re-engineer that so the list of issues we see during commercials is reduced substantially? Halloran, I don't know who asked the question, but it's reduced substantially. And this is the first time pharmaceutical companies can get down to a level to where they can fix medications and get rid of those little nitpicky things that all drive us nuts and make us not want to take a drug.
Good. Another question here. How do you see this working from a contractor perspective, like Ask a Nurse, who's not directly connected to the patient's records per se? Jennifer or Dina?
Yeah, sure. So Ask a Nurse or any outside system in Microsoft land that's just an import of data. So it doesn't have to be a Microsoft solution like what we showed today. If it's an electronic medical record and Ask the Nurse, as long as they're capturing data, they have a database, we can integrate it into the solution. Those common data model tools, Microsoft gave us those with Fire APIs, so we can push and pull data back and forth. So it's fully inoperable to any system that's out there, including Ask a Nurse.
Another question, do we have to use Azure device tracking?
I'll leave
Tanya,
John
take
do
that
that.
one. Yeah.
No, we do not. I mean, we can use multiple types of like internet as medical devices as you currently have them. You know, that data can be stored using multiple app. Not only the APIs that we've got with our application, but we also leverage the fast healthcare interoperability resources APIs. So that's all backed by the platform as a service, and that offering is in the cloud. So that connects either Azure IoT devices or other devices outside of that. Yes. And that 100% is all HIPAA compliant and high trust certified.
Another question here, can I use this for a platform to educate my patients about their device?
Yes, I'll take that one, it's Dina. Yes, you can. You can actually build out and embed patient information into the device if they had any questions, or possibly link them to a website for your patient information.
See, it looks like those are all the questions we have for right now. Jennifer, Dina, John, anything else you want to add?
No, we appreciate everybody's time and the questions. They were great. Thank you.
Great. Well, then that's all we have for today. Thank you, Jennifer, Dina, and John for presenting today, and everyone else for joining the presentation.